and Excellencies, dear colleagues and friends, 12 years ago, a new virus emerged and sparked a pandemic. Life-saving vaccines were developed, but by the time the world's poor got access, the pandemic was over. 1 year ago, a new virus emerged and sparked a pandemic. Life-saving vaccines have been developed. What happens next is up to us. We have an opportunity to beat history, to write a different story, to avoid the mistakes of the HIV and H1N1 pandemics.
Coronavirus vaccination programs have begun worldwide. But, as we just heard, Dr. Tedros and the World Health Organization fear that poorer countries will feel the greatest impact of the pandemic. Official data shows coronavirus deaths and cases have surged in Africa since December. Africa Science Focus is taking a closer look at the scale of the outbreak. This week, our program asks why coronavirus cases increased so rapidly in the region. Jubiel Zulu speaks to people across Zambia and Malawi to find out what they think about the efforts to manage both coronavirus and vaccinate communities in the region against COVID-19. Let's hear now from one of those people Jubiel spoke with. This is Stella Piri in Zambia.
The number of people dying keeps on increasing, but I just don't know what to believe. And we have also some recording going around on social media that we shouldn't go in clinic or test for corona because they will cure us. For me, I even fear to visit the clinic even if I'm sick.
Stella is talking about a voice message that has been circulating via messaging services such as WhatsApp. Here is a section of that message with the translation from Jubiel.
I want to share some information. Stop going to clinics. Relax and wait until this pandemic ends, because this is not a normal COVID-19 pandemic, but this is a time for human sacrifice. Even if you're not seriously ill, the next thing will be to inject you the COVID-19 vaccines, and you will die. These drugs kill. Circulate this audio with your friends. Protect the life of your mothers and everyone. Don't allow people go to clinics. The sacrifice keeps on because the gassing incident the country faced sometime last year did not kill a lot of people. So, COVID-19 is a trap. When you accept the drugs they will give in clinics, you will die. Please share this information.
The speaker claims that she is involved in healthcare. Stella says that in recent months, she has seen less and less official information about the pandemic. These knowledge gaps can be filled with misinformation about changes in the virus and how COVID-19 vaccines work.
In the past, we could see some people going around with megaphones to ask about diseases like cholera, but now it is been quiet, so I wonder if their strategies are made known to them only. There is the relaxation of health measures that were put in place last year. Now social distance is not at any time soon. Look at our buses. A small bus will carry 18 people plus a conductor who just stand and a driver. People have stopped trusting these health people and where's the vaccine? I just don't know what to believe.
2 weeks ago, Africa Science Focus reported on the news that faulty condoms and other health products had been distributed across Zambia. The repercussions of that crisis are still being felt. Here are citizen Isaac Njovu and James Kayua.
I would not say much as in I know anything about the vaccine. I would wish to have more detailed information that will also convince me so that I can be one of the ambassadors also to give a testimony about it. Yeah.
Okay. Do you trust your government and health officials?
On that one, it's a bit tricky to answer that question. First, I'll comment by saying if we cannot trust just the past scene that happened, how am I going to accept what is coming that I have not yet been convinced with? So that becomes a bit of a challenge to accept it, unless if I see the results even from the ones that are even supplying us these vaccines.
Last week we had the permanent secretary telling the nation that they have acquired 8.4 million vaccines to give to, which is half of our population in Zambia, to give to the general public. I would take yes, but it has to come with a clear picture, because at the moment as we are talking right now, people have different feelings with our government. They have mistrust with the government, including myself. I also have some mistrust with the government because of the recent stories that we heard of the honeybee giving out expired drugs to the public, giving out leaked condoms, all those things. So we don't know how true that this vaccine has been tested and it has been proven that it needs to be used.
Since the pandemic broke out about a year ago, much has changed around the world and in sub-Saharan Africa. It was widely reported that the region's 1.1 billion people had largely avoided the devastating impact of the disease that has been seen in the United States, Europe, and Latin America. Many believed that the continent's young populations and strict lockdown measures had limited the spread of the virus. But in the past few months, cases have begun to surge. The WHO reported in December that cases and deaths in Africa had increased 40% in just 1 week. Professor Roma Chilengi, the Chief Scientific Officer at the Center for Infectious Disease Research in Zambia, tells us more.
Whether we are seeing more numbers because more people are getting tested, or whether it is the reporting that has improved. I think the answer is twofold. Firstly, indeed, more people are getting tested as the testing becomes more widely available, as there is much more awareness of the disease, so there is more testing being done. However, the important numbers to track are the proportions of those who turn out positive from the totals tested. That's what would give you an indication of whether you are having increasing numbers or not. In other words, the positivity rate. It is true that we have experienced greater positivity rates in the second wave than we ever experienced in the first wave. In fact, it has more than quadrupled in the sense that we were repeatedly around 1% positivity. Now we are consistently around 10% positivity.
This second wave in sub-Saharan Africa has involved variants of the novel coronavirus. So, what do we know about these new strains?
And my opinion is of course that we don't know enough about these variants yet. What we do know is that they are much higher transmissibility than the original virus. There are some schools of thought that are suggesting that they will be more deadly than the original virus. That I don't have specific evidence to support or refute. So we will wait and see. I think the key question that goes with these variants is whether the vaccines that have been developed will be protective against the variants. At the moment, the evidence seems to suggest that the vaccines are broadly cross-reactive and should be able to protect against the variants. However, this is a question that is subject to ongoing research, and we shall know more as time goes by.
In Malawi, cases of coronavirus disease are also on the rise. But Professor Adamson Muller says that the increase there may be driven by different factors to those found in Zambia.
With the difficult socio-economic circumstances that are obtaining in South Africa, currently we are having many of our people returning back from South Africa, as South Africa is one of the countries in Africa that is heavily impacted by COVID-19, and when they reintegrate, they cause a spike in the number of cases of COVID-19. That is the main factor we think is behind that.
Professor Adamson Muller ending today's show on rising coronavirus cases. In next week's program, we will hear more about some of the coronavirus myths and misconceptions that are spreading in sub-Saharan Africa. And we talk to the people who are working hard to set the record straight. The rainy season can bring a range of troubles in Eastern Africa. This week, we have a question from Rita Nayame.
What causes cholera? And with the floods in Lusaka contaminating water causing diarrhea, will it lead to cholera?
I'm Dr. Fred Kapaya. I'm the National Cholera Elimination Coordinator based at the Zambia National Public Health Institute in Zambia. Now, cholera is caused by a bacterium called Vibrio cholerae, and this is particularly after consumption of contaminated water and food. The last major outbreak that we experienced in Zambia was in 2017-2018, which started in Lusaka and spread to 6 other provinces. Following this, we conducted vaccinations with oral cholera vaccine in Lusaka in 2018. And since then, we've not experienced any cholera outbreak to date in Lusaka. However, I must be quick to mention that we had an outbreak in Mpulungu and Sama districts in Northern Province in 2019. We also proceeded to vaccinate people in Mpulungu in 2019, and since then we've not had an outbreak of cholera. Currently, we are actually vaccinating people in Sama district and Shuguyunji. We started in December 2020, and we hope to finish the second round in this year.
Many thanks to Rita and Dr. Kapaya for the important information. If you too have a question about science, technology, health, or environment, get in touch. You can contact us from anywhere in the world via WhatsApp on +254 799 042 513. You can subscribe to our program and download episodes at www.scidev.net. And if you've been loving Africa Science Focus, leave us a review on your favorite podcast app to help others to find us. Today's program was edited by Jackie Opara Fatoye and Fiona Broom and produced by Harrison Lewis with reporting from Jubiel Zulu. I'm Selly Amutabi. See you next Wednesday. This program was funded by the European Journalism Centre through the European Development Journalism Grant Programme with support from the Bill and Melinda Gates Foundation.